I graduated from the medical school at the National University of Singapore in 1986, and I went on to specialize in internal medicine. Following that, I decided to further specialize in medical oncology, which initially I trained in the Singapore General Hospital, and followed by a 2-year stint in the Memorial Sloan Kettering Cancer Center on a government scholarship under the Health Manpower Development Program. After my return to Singapore, I joined the National Cancer Center, initially as a registrar, and rose through the ranks to become a consultant and senior consultant. I took over as the head of medical oncology department in 2001. At that time, while I was also looking after the division of clinical trials and epidemiological sciences, one of the research divisions that looks after clinical trials in the cancer center. I left the National Cancer Center in 2004 and joined the Parkway Cancer Center since then. But after spending 2 or 3 months in the department, I realized that it was a very special discipline. It did not occur to me that so much could be done for cancer patients using medications, and that's what medical oncology is all about. The other aspect of the specialty that attracted me was that because these patients are chronic patients, because the encounters are pretty intense due to the nature of the disease, you eventually develop a very close relationship with the patients and their family, and that adds a special touch to the practice of medicine. Back in 1992, when I first started oncology training, although there were medications, there were treatments for cancer patients, it was still relatively limited. But things have changed so much over the last 20 years. In fact, I think it was like a revolution, that the treatment in most common cancers have improved so much that we have second, third, fourth line treatments that are so much more effective than what it used to be before. The things that I thought was not possible in the past is now possible. So that was the most surprising thing to me, the pace at which the progress has been made over the last 20 years. I come to the hospital every day, as long as there are patients in the hospital, including on Sundays and public holidays. So it's a pretty intense schedule, but I enjoyed it. A high for the day will be the day when patients have been treated and successfully completed their treatment. A day when good results have been found after treatment, as cancers are regressing, cancer improving. A day when a patient celebrates 5 years after the initial diagnosis of cancer and found to be still clear and in remission. It's an exciting milestone for many of them. These will be the high points in the day.